girls have just left the building. It's like Elvis. Elvis has left the building. The girls have just left. So go ahead and support them in any way that you can. I can't believe we have the softball champs. And that's kind of a good transition as we talk about Shriners here and bring in Angie, because we're talking about sports and everything else that goes on. And there could be injuries and things like that. We want to make sure our kids are healthy, ready to go when they go back to school to play fall sports. I played a lot of fall sports, when I was in high school and growing up all through the, as I was growing up. So sports is obviously really big. So Angie, welcome.
Thank you.
Before we get rolling, Shriners, obviously, for people that don't know, do absolutely amazing things, right?
Yeah, we're a children's hospital here in Sacramento, and well, actually nationwide and international, but yeah. I'm from the Northern California Shriners, and I'm here today to talk about the sports medicine, children's sports medicine department. So we have orthopedic surgery, we have physical therapy, we have kind of everything in between, diagnosis, treatment for all of your kids with sports injuries.
Yes, all right, so let's do this to prevent some of these injuries. That's what we really want to do. But if there is an injury, they know how to take care of that, which is a great thing. Tell us about these injuries that can possibly happen during fall sports. There's got to be some that are more, I don't want to say popular, but more, the word I'm looking for, that happen more than the other ones do.
I mean, I think in general with children, we want to be a little bit more careful, and they need specialized care because they're growing.
Yes.
And so today, if we're going to get ready for fall sports, then, we want to talk about first, participation barrier. So if your kids have not had their sports physicals yet, they need to get their sports physicals.
I remember getting those, yeah.
B, it is safer to play sports if you show up in shape. So if you show up and it is going to be hard for you to practice for that 1 to 2 hour time frame every day, you're more likely to get hurt. So we want to show up in shape.
We should show up in shape, and we should ease into it, right?
Yeah, so we have 2 weeks until Saxon Unified starts. So the high school kids are already probably practicing. But for our little kids, if you've not been active this summer, every little bit helps. So we need to get moving a little bit.
Got it. Yes, keep things going. What would be the most common sports injury that you kind of see?
I think that's tricky because it depends on the age, right? Our high school kids, ACL is a very common and popular thing to talk about. We treat a lot of kids with patellar instability and kneecap dislocations at Shriners as well. Sprains, strains, and then in children, overuse injuries, they're still growing. So we have to they're more prone to overuse injuries because of the growth aspect.
Okay. All right, you brought some things here to kind of go through some stuff. We got about a minute and a half or so to kind of go through some stuff. We can, is there some exercises you want me to try to attempt here? No, talk about easing into it. I'm going to really need to ease into this stuff, right?
So talking about flexibility, bones grow a little bit faster than our soft tissues, and femurs grow fast.
Okay.
And so I wanted to do a hamstring stretch to start.
And boy, do I need them too. Don't laugh at me. I really need hamstring work, yeah.
Okay.
All right.
Here we go. We're going to lay this down so you're comfy.
Okay.
Get your head on there.
Am I laying down?
Yep,
on my
your back.
On my back. I'm laying on my back.
Please.
Okay. All right, let me get on my back here. Oh, see, that's the hard part right there, too. Getting it out on the ground.
This part's easy for children.
Oh, that actually feels good right here.
Yeah.
Okay, so I'm good. Yeah.
Okay, so one leg's going to stay straight. I'm going to hook this around 1 foot. We'll do this side. Perfect.
Nice.
And then we're going to keep your knee bent.
Okay. That's about, bent.
Yeah,
Sorry,
bend it. Now you get to grab onto this.
Got it. Okay.
There you go.
Perfect.
Okay, now you're going to bend or straighten your knee.
Yes, I can straighten it.
Until you feel a stretch in the back.
Yes,
okay?
I feel it.
But we like it so that you have some across the knee and some across the hip here, so that it's in the hamstring.
And I can keep on doing this, right?
You can move or you can hold.
Yes.
Yeah.
I think I'm gonna hold right there.
Awesome. And stretching work.
And believe me, this is good for me, right? I can't believe I'm going this high. This is good. I'm getting thumbs up over there. Oh, yes.
If you're wondering if your kid has a tight hamstring, with the hip bent at this kind of right angle, 90 degrees, the knee should be almost straight.
It should?
For good flexibility. So
I'm somebody's kid.
We have a little work to do here.
All right. Let me, hold on. I want to hook the other one up so I can stretch that out too. So this is just one of them, right? You might have to do that. I don't think I can bend down that far. Okay, good.
We're going to do something that requires a little more balance and mobility.
Oh, I like this. All right. I can't believe we're out of time. I'm going to lay down here while we just finish things off. Well, thanks for coming in. I really appreciate it. There's so many more exercises that we can do. And the whole thing is make sure the kids are safe when they go back to school to get into their sports.
Be in shape. Work on your flexibility. And come see us at Shriners Children's if you need help.
I need to do this before every single show. Thanks for coming in.
You're
All
welcome.
right, we'll throw up some information. I'm just going to lay down here. I don't even know what else is coming up on the show. Hopefully, I'm going to go to commercial after this. There you go. There's your information right there for you to check out. Everything on the screen. And yes, we will be coming right back. Don't go away. I need a pillow or something.